Then we place a clamp on the foreskin in the area we will cut to prevent bleeding. Next we make a slit in the foreskin and then peel the foreskin back from the head of the penis. The major risks to this procedure, as with any surgical procedure, are hemorrhage and infection. Occasionally, injury to the foreskin and penis can result from this or any other surgical procedure.
Caring for a circumcised penis is really hard because you've got a new wound and a new little baby. So you have to protect it against infection and so on and so forth. An intact penis is very simple to take care of. In infancy, you wash the penis like you'd wash a finger. No one should retract the baby's foreskin. It doesn't need to be retracted. And in fact, you can't. It's attached to the head of the penis and somewhere between birth and puberty. These two structures will separate. And then a male can be taught to retract, rinse, and replace. Very simple.
Another argument to consider when trying to decide whether or not to circumcise your child is the issue of human rights. If in fact it is true, as previously documented, that the foreskin is a normal functioning part of the male anatomy, does a parent or guardian have the right to have it amputated, especially in the cases where aesthetics or the "I want my son to look like me" argument is the main reason? Do you as a parent or guardian own that right? Or is the choice one that your child should be able to make on his own behalf when he is old enough to make his own informed decision, thereby respecting the rights of the child to his own body?
Every person has certain rights just by the fact that they're alive. They don't have to do anything, they don't have to have any special status. Just because they're a person, they have rights, human rights. We believe that male circumcision violates some of those rights. For example, the right to bodily integrity and the right to protection. People understand these rights with regard to girls a little better than they do with boys, and I think part of the reason for that is that the female circumcision doesn't usually happen in the U.S. and the male circumcision practice does, and it seems familiar to us. It doesn't hurt. It happened to me maybe, or it happened to my friend or my brother or my husband. It can't be anything bad, but in fact it is bad. It has a number of things that it does that really does, we believe, does cause harm. Taking something away from someone that they're going to be without forever, the only one who should decide that should be the person themselves. If it's going to happen when they're a child, it should be the child who makes that decision. And if the child is too young to make that decision, it shouldn't be done. You should wait until the child is old enough. Anything else is a violation of human rights and law.
Remember, circumcision is non-therapeutic surgery done to a baby without need. There's no reason for doing it. So, to my way of thinking, we should leave the boy intact, not violate his being with pain and terror, and leave the decision up to him. It's his body. Let him make the choice for himself.
I'm Paula Brinkley. I'm a pediatrician and I'm a mother. We chose not to circumcise my son after actually not very much discussion. It was a pretty easy decision for my husband and I. The only reasonable decision that I could make as a mother was to leave my son intact until he reaches the age where he can make that decision for himself. And he will do that, presumably, one way or the other when he reaches that age. But I couldn't live with myself making such an irrevocable decision on his behalf.
So I believe very strongly that we all have a right to self-determination, that it should be our choice whether we want to have our body modified or not. And that right has been usurped by a culture that thinks that this is a wise thing to do for all kinds of erroneous medical reasons, all of which have been disproven. And so the role of the father, who's generally the protector in the family, even if he doesn't believe in keeping the boy intact, has still the duty to protect his boy's right to make the decision for himself, regardless of the father's decision. And it's that role to protect the boy that is fundamental for the father.
It's important to acknowledge that infant males are not the only children who are suffering from what is termed genital mutilation. In certain countries like Somalia, Sudan, or Ethiopia, it is, to this day, a common practice to circumcise young girls.
I am Soraya Murray. I'm from Somalia originally, living in Los Angeles. I'm a human rights activist. The thing that really shocked me when I came to America was the reaction I got when people find out what was happening in Somalia, Sudan, Ethiopia, those parts of the world, Egypt, about female genital mutilations, and people were horrified, they were shocked, they were angered. It was not even a feminist standpoint, but it was the rights of the child, taking her humanity and integrity. But behind closed doors, they were mutilating their own young, boys, sons. And it's everyday ritual here, but people don't see it as a ritual. But to me, I would see it as ritual because it's the same thing to me, because mutilation is mutilation. I feel this is really wrong when it comes to child's rights. This is a human rights issue. And I think all of us need to protect young children's bodily integrity. And what amazed me is that when she showed me a tape, a young boy who was just born having the surgery done, exactly the same way they tied us like a goat on a table, surgical tape. This child just born right now, and his scream was exactly the scream that I heard when that young girl was brought before me. I felt the pain that he's in it because I've been there. I was exactly like him, so I saw myself in him. Young women lose a lot. The genital mutilations effect is a long-term, horrifying, mentally, physically, and emotionally. But we don't know what happened to young boys because they don't want to investigate. There is no doubt in my mind as a survivor that when I found myself tied to that table, that trust between my mother and I was broken.
So you've been bonded with your mother for 9 months in utero, and you come out. If you're lucky, you get held in arms, you start nursing, you're making a new kind of bond, and you suddenly have this traumatic sexual experience that's pain. You feel betrayed. We know that infants often won't look at their mother after they've been circumcised for some time. The trust bond is deeply broken, and it takes a while to recover that, if ever. So circumcision interferes with breastfeeding, it interferes with sleep patterns. It's like a total shock. The infant is plunged into shock. Often they think they've gone to sleep and it doesn't bother them. They've gone into shock, and they'll remain in shock for quite a while, maybe your whole life at some level. What would that give you as an impression of life? What does that do? You've got then scars physically on your penis because all of these nerve endings have been removed, this most sensitive part of your body, and you've got psychological scars. You don't remember it, but you'll never forget it. And these are deep. This runs very deep both through the individual and a culture of people who are, by and large, circumcised, like the US and several other cultures.
If circumcision were done in the hallway instead of behind closed doors, it would stop tomorrow because people would know what was happening to their babies, and they would never allow that to happen to them.
So as you've seen, there are no specific agreed upon medical reasons for doing a circumcision. The idea of circumcising your baby boy so he'll look like dad is kind of silly, isn't it? Especially when you look at the fact that in many, many states in America, most boys are today being left intact, and many parents are saying no, and I agree with that. I'm Dr. Dean Edell, and thanks for watching.